The earlier in the career of people who are training in the medical field, the earlier this education, this experiential encounter, so to speak, with the reality can occur, the more likely people are to have an open acceptance and be willing to treat all patients equally, regardless of any of the circumstances about which we may have biases.
I don't have a job. I'm living in a storage unit. I've given away everything in my life to support a drug habit, including my family, my loved ones, my wife.
We look up to you like a child would to a parent. So it's crucial that people in the medical field don't look down on us. Even though we're looking up to you, if you could look back at us eye level. What did you used to do as a profession, and how has the medical establishment made you feel today?
I was a CNA for 27 years. I worked in healthcare. They made me feel like a piece of shit, garbage.
Straight judge you off the get, and people suffer. Like, I've suffered from tons of spider bites or abscesses or anything just because you don't want to go in there and be manhandled or just be embarrassed and treated like you're dirt. Like, they just treat you horrible, like you're not even a human being.
AJ, how has the medical community and the treatment that you've received made you feel as a person?
Not like a person. It's made me feel like not even wanting to go to the hospital. It's made me want to do home surgeries on myself. Yeah, I'd rather not go at all. All people have worth. No one should be treated like that due to homelessness or insurance or whatever. They just judge you.
Being a healthcare worker, I never treated anybody like that.
I know that they do not listen to us, and this is a product of not being listened to. My wrist is deformed and will never, ever work right because I'm an addict and I'm homeless. We don't matter. We are less than.
Like, I've seen people's feet about ready to fall off or anywhere, just they let it go so bad because they don't want to go in there and be treated like, garbage.
And how has that made you feel as a person?
It makes you feel little, like you're nothing, and that's the whole point of the hospital, is for them to take care of you. And I mean, just because people are addicts or they're in the streets, those are the people that need the help the most.
Have you been treated differently once they find out that you have a history of drug use?
My dad told me never to let that be on my medical record, and he was right. Yeah, they judge you from the minute you get in there, just by how you look. If you look homeless, if you have a backpack, they definitely judge and stereotype, make you wait for hours, and yeah, they treat you like not a person, make you feel really bad. I don't know anybody out here that will go to the hospital. That's why we all go septic and pass away.
What changes do you want to see happen with doctors?
I want to be treated like I'm a human being, like I'm a person, like I have feelings. They're not the only ones.
I just want to be treated like a human. I want to be treated like I have rights, because I do. Just make some mistakes. And there's not a person in the world that hasn't.
How do you want doctors to start treating our community?
It'd be nice if you just treat us and not judge us for our past.
They can maybe see what it's like out here and that there are people too, and that anybody could be homeless any day. Nobody planned or wanted to be that when they grew up. So I just think that they should put all that aside and just people are people.
For me, sometimes it's hard when you living in the streets. You in poverty, shall I say. You don't have money, you're lesser than what they are. But if you have a little bit of money, then you can do a lot more things.
What changes do you want to see in the medical field?
More compassion and more acknowledgement that just because we have HIV, that I matter, that I should be getting the same treatments, the same medical attention as everybody else. I shouldn't be punished for having HIV. A lot of times they don't speak kindly. They're very abrupt, very rude. They need more compassion towards everybody.
He said, well, you only get HIV if you're a whore or a junkie. So which one are you? Yeah, you know what? I'm not going to tell anybody about this anymore if that's the response I'm going to get. And I suffered through 5.5 years of being HIV positive alone.
But I didn't use the whole time I was in prison for 32 months. And then 2 months right before I got out, I had someone come up to me and they said, hey, I got meth and I got a syringe. Do you want to get high? Oh, by the way, this syringe has been used by about 20 people on this block, and about 5 of them have Hep C.
Well, finding out that you have hepatitis and, you know, that supposedly at that time it wasn't no cure for it. I didn't even know I had it. But when I found out, it was scary.
My name is Jessica Arbogast. I'm a family nurse practitioner. But when I first started working with people with an addiction, there was so much stigma around their medical care. And I was just sort of appalled at the stories I would hear from patients about how they were typically treated in emergency room settings, in family practice settings, and they were judged. They would be sort of mistreated by people in the emergency rooms, medical staff. They're not treated like humans.
Yeah.
And it broke my heart because we are in a career, we're in a profession that has compassion. And I felt that there's a lot of lack of compassion.
This is an embarrassing story in a way, but it's real. You know, I was not always so insightful about what we were doing to people who inject drugs, and how I looked down upon them, thought them less worthy.
Stressful anxiety that we have to go through when we have these life-threatening diseases that society is deemed means you're a bad person, means you don't deserve help.
I can remember vividly some instances where I absolutely told people, I will not treat you until you have been sober for 6 months. I mean, I have to tell you, I've said that more than a dozen times. You know, I don't know how many times. And I know that probably meant some of these people never got treated, and some of them probably died as a result.
I go in there and I'm like, yeah, I have the blood work right here. I have Hep C. And they're like, okay, let's get you treated. How did you get it? So I was honest and I told them the truth. And they're like, oh, wait a minute. Pump the brakes. This medication's expensive and your insurance company's not going to let us prescribe this to you unless you can jump through some hoops. Get sober, be clean every day for the next 6 months, and then 3 times randomly during this 6-month period, we're going to give you a phone call out of the blue and tell you you have 4 hours to get to this hospital and get a UA done and prove that you're clean. 3 times over 6-month period. When I'm in my drug addiction, I'm not the kind of person that has the same phone number for 6 months. After contracting Hep C, it's like, why do I have to live? I'm going to have this horrible death. So it was just like a free pass for me to go and use all the drugs that I could, and I just kept using and using and using, and I was putting myself in a really dark, depressive state, and I never left the house, and I was isolated, and I didn't answer the phone when the hospitals called and told me to go take the UAs, so they told me I couldn't get the Hep C meds. I have a disease that's going to kill me, and the doctors refused to prescribe me the medication for it. And in my mind and in my heart, it's because, you know, I'm not a good enough person to deserve it.
So when we come to you, doctors, we look up to you guys. Just the education, and you're someone that can help us. So when we come to you, we're taking that chance. So to have a doctor tell you, oh, well, I'm not going to give you this until you do this, it's slightly an abuse of power. And an abuse of power, I'm meaning you have that say-so in our lives. We come to you because you took an oath to help someone who's sick, correct?
Yes.
So we come to you thinking that we're going to receive that or hope that we receive that. But then we're told, no, you have to do this in order to get this. You know, another person telling me I'm not doing the right thing or I'm not living how I should.
Because I'm not living the lifestyle that the medical people think that I should live.
Injection drug use and addiction in particular, is a disease. It didn't start like nobody went out and purposely got sick, but that is a disease, and we have to approach it as a disease. We don't withhold treatment of diabetics if they go out and gorge themselves on carbohydrates and have a significant medical event. We don't say, well, I'm not going to treat you because you did this to yourself.
Because going in to see those doctors and have them tell me that I'm not good enough to be treated for a disease is pretty messed up. And it kind of sets me off to where, why would I want to get treated for anything? Why would I want to go see if I have diabetes? Because they're probably not going to treat me for it. All they're going to do is tell me that I'm sicker than I think I am. That Hep C mentality inside of you, and you don't have anything to live for because you know you're going to die, then how do you get out of that, huh?
If you're using drugs, you're living on the streets, you have no family, you're not sure where you're going to sleep that night, if you're going to make it through the night, there's not a lot of hope. And I think there's always an opportunity to give people a feeling of hope. And treating hepatitis C was this whole opportunity to give them hope of changing something that they acquired during their addiction. And hope is a really powerful emotion because it gives people a chance to kind of see a future. And when people are in their addiction or barely in their recovery, they can't even see the next day. And so hope really kind of gives them that, okay, maybe I don't have to live this way. Maybe I don't have to have this infection. Maybe I don't have to have hepatitis C. And then, it just goes from there.
So you treat people even if they're still using.
Mm-hmm.
Why do you do that?
Treat people for their hepatitis C or?
Yeah, without judgment.
Oh, without, because they're there, that's what they came to get treated for. I'm not there to judge their lifestyle, their choices, but if they came to get something that I can help them fix, then that's what I'm there for.
How was your experience working with stigma-free providers like Jessica?
She made me feel as though that she listened to what I said. Instead of telling me, this, and this, she listened to me.
She didn't judge me for my past behaviors in a way that impacted her ability to be compassionate and helpful for me to have a better physical health. Those doctors didn't ask me if I was using. They didn't drug test me. They didn't try to push me down or anything. They didn't ask me about what kind of behaviors I had or how I got it.
I shouldn't judge you for the way you behave. I need to accept the way you behave and treat you regardless of that. None of us have the right to deny care to anybody simply because we disapprove of who you are, what you do, where you come from.
I went down there, they did a blood test, they found out what type of Hep C I had, and they prescribed me Epclusa, the 90-day regimen. I had to take a pill every day, and I was using it. And I did it. I actually did it. I don't know, it must have been a power greater than myself that came down and came into my life and managed me to be responsible enough to take a pill every day for 90 days straight. I mean, given the fact that it was gonna save me from that horrible death might have been a factor too.
Maybe I can get rid of it, if I do it right. And I did that. And it feels good because I feel a lot better. As old as I am, I'm not gonna say I'm all that old, but I feel a lot better. I can do a lot more things. It's crazy, but it's true.
Because somebody appreciated me enough to make this happen for me. I appreciated that they were doing it enough, that they were doing it for me enough to follow through with it. Do you know what that did for me? My life today is 1,000 times better than it was 3 years ago before I got treated for this disease.
My goal is that they'll have a little bit more self-love if they feel that someone cares for them.
I realized something. Now that I'm cured from Hep C, I can love myself. I can love myself enough to not get high today. I've lost 98 pounds and I feel beautiful again. And I get to shovel snow and I get to mow lawns and I get to go to my mom's house and I get to help her take her trash out or change the heater vent. I get to live a life worth living and doing beautiful things for the people I love and having the people I love do beautiful things for me. When we do good things for each other, it's like throwing a little pebble in a pond, and those ripples go out in all directions, and those ripples affect so many people. And I'm not 100% sure who's going to view this video, but I promise you this. If you have the opportunity to give someone the benefit of a doubt and show them that they're worth loving, they might just grasp onto that and start loving themselves enough to learn how to be able to do that for other people too. The medications did something to me that made me feel better. But the love that I got from Hope on Tap was the true medicine that made me into this person that I am today, that has a family and people that love them, and I have a future.
Hope on Tap is about love and making everyone feel that they deserve to feel better. I tried to keep it short and quick.